Good afternoon, and thank you for joining us for today's webinar for a first look at Cognito's chronic disease conversation skills. Before we get started, I have just a few housekeeping items to run through. Today's presentation will be recorded, and a copy along with the slides will be sent out to all registrants. Attendees are in listen-only mode. However, if you'd like to chat with us or ask a question during the presentation, you can do so on the right-hand side of your screen in the GoToWebinar control panel. Finally, we invite you to connect with us on social media by tweeting @Cognito or using the hashtag CognitoWebinars. I'd now like to introduce today's presenters, Gurnik Singh and Dawn Bornheimer. Gurnik specializes in the application of digital innovations to improve healthcare delivery, reduce staff burden, and drive patient education and engagement. Gurnik has held leadership roles as channel and innovation strategist for health systems and private enterprise. Gurnik joined Cognito in 2018 to lead the growth and development of Cognito's virtual human simulation solutions for healthcare and currently serves as the head of product for the healthcare market. Dawn Marie Bornheimer is a published author and industry leader with a unique combination of interpersonal communication skills and partnership development with a focus on education and social impact. In her nearly 20 years of professional experience, she has worked at Johns Hopkins Bayview Medical Center in their psychiatric rehabilitation program. She taught for 5 years in the Baltimore City public school system and facilitated business development initiatives for Kaplan Test Prep, Capella University, and NYU Langone Health, joining the Cognito team in March of 2019. Dawn currently serves as the Director of Clinical Health Partnerships, preparing current and future providers. I'd now like to turn things over to Gurnik to kick us off.
Thank you, Scott. Good afternoon, everybody. My name is Gurnik Singh. I am the head of healthcare product at Cognito, and I get to build virtual human simulations, which is actually quite a lot of fun. I enjoy it quite a bit. And my focus is really on preparing health profession students to lead effective patient encounters in real life. And at Cognito, we believe in the power of conversations to change the course of individuals' lives. And we focus on conversations as instrumental tools in driving positive changes in social, emotional, and physical health. Next slide. We have spent the better part of the last decade developing, studying, obviously, which is key, and delivering evidence-based simulation training using virtual humans as the subject of practice. Our simulations are being used by a wide variety of organizations to help providers and educators lead effective conversations on challenging health topics. Cognito simulations are the only simulations included in the SAMHSA HHS National Registry of Evidence-Based Programs. And specifically in the clinical training space, our simulations have been integrated into curricula at hundreds of schools of nursing, medicine, social work, and more, thanks in large part to our immersive instructional design and the cutting-edge use of virtual humans. So let's take a look at the next slide and talk a little bit more about virtual humans specifically. So the science behind virtual humans has been developing over the last 2 decades, and they've really been proven to be excellent subjects of practice. Study after study has shown that people, all kinds of people, race, gender, age agnostic, like interacting with virtual humans. Learners report feeling less judged compared to interactions with live persons, and freer to express themselves honestly and experiment in the interaction, which is of significant benefit to learning. Virtual humans offer us as trainers and educators exceptional control in delivering practice that focuses on specific skills with measurable outcomes. And importantly, the experiences can be reproduced with perfect fidelity for every single learner. Next slide, please. Cognito's virtual human simulations are web-based and designed to be self-directed, so learners can engage and practice an encounter on demand from anywhere when it's most relevant and timely for them. In the experience, the learners meet an AI-powered virtual human that has a unique persona, adaptive memory, and a real human voice that supports both verbal and nonverbal emotional responsiveness. In addition to the reactions and dialogue of the virtual patient encounter, there are several dynamic feedback mechanisms that give each learner critical instruction throughout the training. There is a coach feedback that helps learners understand effective and ineffective choices as they make them in the conversation. There is an engagement meter that helps learners track how well they are maintaining rapport and engaging the patient holistically on the way towards achieving their encounter objectives, as well as opportunities to hear the patient's thoughts, which will appear periodically to help the learner understand the perspective of the patient as they navigate sensitive and challenging conversation topics. So as you can see on the slide, we've applied our instructional design and virtual simulation expertise to several different key areas within clinical practice to offer dozens of training scenarios. Learners can gain practice in behavioral health, pediatric, and chronic disease cases, while also experiencing virtual patient interactions in an array of settings, whether it's ambulatory care, primary care, inpatient, in-home, or our recently added telehealth environments. We've also developed practice scenarios to help learners develop essential soft skills for working effectively with colleagues and collaborating in a multidisciplinary or cross-functional environment. So today, we're going to focus on our newest simulation product, Chronic Disease Conversation Skills, which helps, again, expand practice in the area of chronic disease management. Next slide, please. So in order to build any of our simulations, but the Chronic Disease Conversation Skills especially, we marry our virtual human technology and our internal instructional design expertise with clinical and communications training expertise from subject matters in the field. So we work with these subject matters to pressure test the simulation scenarios for realism, and in order to gain their contributions to the instructional design by guiding the application of evidence-based techniques and best practices to the training experience itself. So in addition to the clinical experts, we also work with patient relationship and patient advocate experts as well to ensure a realistic experience from the patient perspective. Right? It's critical in order to demonstrate realism that we're capturing what patients are thinking, what patients are motivated by in the encounter, which is often coming from very different perspectives, very different places than the clinician in the encounter itself. Our development process also allows us to capture and incorporate real-world experiences from people who have lived these conversations. So as you play through a conversation, you will notice very salient anecdotal elements that you can only really gain from practical experience having these conversations with real people in the real world. So on this slide in particular are a few members of the development team for the Chronic Disease Conversation Skills simulation. I'll call out Dr. Michael Goldstein, who is a lead researcher and educator with the VA system, who helped us in the design and implementation of the simulation with the mind to incorporate this tool specifically across the VA system, which we have done in an earlier iteration. Let's go ahead and take a look at the next slide. So in Chronic Disease Conversation Skills, the simulation is designed to train providers to use motivational interviewing with patients struggling to manage chronic disease. So learners are shown and then also have the opportunity to practice applying core MI skills like asking open-ended questions, using simple and also complex reflections to demonstrate empathy, and helping patients build SMART goals that support their chronic disease management. Let's take a look at the next slide. In this simulation, learners will work with 4 different virtual patients, each with their own challenges, their own persona, their own backstory that has to be identified, uncovered, and addressed in the course of the management discussion. So learners get a chance to practice effective engagement strategies for dealing with chronic disease topics such as medication adherence in diabetes management, nutrition and physical activity planning in obesity management, cardiovascular disease management, and smoking cessation conversations. And prior to each conversation, we provide the learners background on each of the individual cases, key learning objectives for the experience so they know what they're expected to achieve and how they're going to be measured in terms of their competency before leading the conversation themselves. Next slide, please. The simulation is designed to help learners develop their motivational interviewing skills through progressive series of challenges. So in the first encounter with Lisa, they're going to go into a basic conversation in which the virtual patient starts at a higher level of motivation, so they are already easier to engage, more involved in their care already, and looking for solutions. And that will require them to use fewer or less advanced MI skills to achieve the visit objectives. After they complete the conversation with Lisa, they progress into the conversation with Janet, where they're going to encounter a patient with much lower motivation, who's going to require more advanced MI skills in order to accomplish those visit goals. The remaining 2 conversations in the simulation with Gregory and Kevin allow learners to select either the basic or advanced modes based on how well they feel they have progressed in their MI skills development through the Lisa and Janet conversation. So if they feel like they've got it down, they're on top of it, they can jump right into an advanced conversation. If they'd like to review the more basic elements of MI, they can engage Gregory or Kevin in a basic conversation as well. Further, learners are also able to test their comprehension and retention by turning off the coach feedback mechanisms. So they will then no longer receive the feedback that helps them understand what is a ideal or less ideal choice and what the implications are for their progress, so they can undo and revisit the choices. So instead of serving as just practice, we can turn these conversations into a sort of assessment that helps them see how well they can progress without all of the feedback mechanisms. At the end of each conversation, so Lisa, Janet, Kevin, Gregory, all of the conversations, learners receive a personalized performance dashboard with directive feedback on their choices through the conversation and recommendations for how they can improve. So without further ado, let's go ahead and play a little bit of the simulation, get a chance for everybody to see how all of these different tools interact with one another. So I'm going to go ahead and share my screen here in a moment, and we're going to jump into the simulation experience. All right, so on my screen now is the menu for the simulation itself. Learners will have the option to go ahead and start their conversation with Lisa, or alternatively, there are additional resources and materials that they can access ahead of time that provides them with the key takeaways and skills that they're going to need to successfully navigate these conversations. And these materials and resources, while there is a complete set of information here, can also be customized for each institution. So if there are institution-specific or program-specific elements that you want to incorporate and make sure students are exposed to as a part of the simulation experience, those can be incorporated here. So I'm going to go ahead and jump into the conversation with Janet in the more advanced mode to give us a sense of the level of complexity and the different feedback mechanisms that are going to be incorporated here. So we'll go ahead and start from the beginning with Janet and see all of the different mechanisms that are available to us. So we start off with some background on the scenario. Janet Lopez is a 56-year-old veteran, heavy smoker with coronary heart disease and episodes of chest pain. And our primary goal in this conversation is really to engage her in a conversation about smoking cessation, right? So she's a longtime smoker, may not be motivated, right? And we know this is an advanced conversation, so she's going to be a little bit more prickly about the topic. And it's our objective to explore her perspectives on health, use reflective listening and shared decision-making, core MI techniques, to understand her motivations and try to develop a plan that's going to work for her, and really assist Janet in developing a SMART goal to get started on specific action she can take to begin smoking cessation. So let's go ahead and get into the combo.
The last chat was 6 months ago. It's good to see you again.
Good to see you too.
Okay, so your blood pressure is good and your recent blood work looks good. How are you doing?
I'm doing just fine. That said, I'm pretty busy at the moment.
No problem. We'll keep this as short as possible.
All right, so at this point, the user interface emerges after we get a little bit of the backstory, and we see that we have the option to select several different ways that we can begin the conversation with Janet. The options should populate as tactics, and under each of these different tactics are specific dialogue choices that we can select. Down here, which isn't activated yet, is our accord meter. This is going to move up and down based on how well we are engaging Janet and motivating her towards a specific behavior change. So I know that if I make an observation, it shows that I'm being attentive, right? So let's go ahead and make an observation and see how that impacts Janet and what the simulation will tell us about that decision.
Seems like your cough hasn't improved since the last session.
Oh, you noticed.
Well, coughing is common in chronic smokers.
Coughing I can live with. These chest pains, on the other hand.
A lot of important clues in the dialogue itself, right? The chest pains are more important than the coughing. So we're going to have to figure out how to utilize that to get to where we want to get to around smoking cessation. But we also see now the coach feedback has been activated. So let's see what the coach has to tell us about that particular decision. There's a good observation, right? We wanted to make an observation and it was a solid one, but it would have been better to ask an open-ended question to understand what Janet's prerogatives were, to allow her to set the agenda, right? So we see now the accord meter has gone down, decreased, because our selection was not necessarily the best one for developing that relationship and getting to where we want to go to. So in this instance, because I know I could probably do better, I'm going to actually undo that choice and go back to the original tree. So we can see here, this one's grayed out, letting me know that I've already selected it. And let's go ahead and follow through on the recommendation and ask an open-ended question that's going to let Janet help set the agenda a little bit. So let's just check in with how have you been lately?
How have you been lately?
I have another exhibit coming up. It's taking up most of my time lately.
Art, right? Painting?
That's it.
I can imagine that putting something together like that takes a lot of energy and focus.
Yes, but I fit in a little exercise when I can, like we talked about last time. Something's better than nothing, right?
So we see the accord meter goes up in this instance, right? And a few things happened. We may have noticed that the response of Janet holistically, both verbally and non-verbally, was more positive than previously, right? And it alluded to some of the elements that perhaps they discussed in a previous visit, right? Which is showing a connection to some of the other motivations that you may have wanted her to exhibit. So a lot of information unfurling in the course of the dialogue. We make sure that we capture a lot of that in the dashboard at the end, which we'll take a quick look at. And there are mechanisms for incorporating this into debrief discussions, which my colleague Dawn will talk about in a little bit more detail next. So we've made a good decision, and we see the options now have adapted. And so the course of this conversation is going to continue to shift based on the choices that I make. So there are, in fact, dozens and dozens of different pathways that students can take through the course of this simulation. That creates a couple of really interesting learning opportunities, right? The dashboard will help us understand what they did well and what they didn't do well, but it also allows the students to explore multiple different ways to engage in this conversation and really learn what works well and what doesn't. One of the great things about the simulation itself is everything that we do in this is tracked. And all of that data is available for us to analyze and understand how students are learning and developing their MI skills. One thing we note across the board is students spend approximately 50% longer than the bare minimum it would take to complete the simulation. And what that tells us right off the bat is they're exploring different pathways. They're trying to understand what good looks like, what maybe doesn't work so well in developing their own style as they want to incorporate this into their real life practice. So I noticed that she made a couple of mentions, right? She's got an art exhibit coming up, and she also talked about her exercise. And within each of these, I have different ways I can talk about what she's doing. So in this case, I see I still have an open-ended question here. This one, not really so much of an open-ended question. I know open-ended question is probably the way I want to go. So let's actually see what happens if I don't choose the optimal option, how the simulation helps me understand what's good and what's not.
A little exercise is nice, but last time we discussed more than a little.
I walk along the beach and chat on the phone with my friend Margaret. Seems like it does the job.
So how often are you walking and for how long?
About half an hour, like 2 or 3 times a week.
Half an hour is okay, but really, you should be aiming for 5 or more days a week.
I'm 56 years old. Walking 3 times a week is as much as I can manage. And with my work and the exhibit and everything.
So we have more coach feedback. The accord meter didn't really change, right? We didn't necessarily hurt our relationship, but we didn't help it either. Let's see what the coach said. So again, well-intentioned, right, by trying to help her understand what is a good goal, right? We want her to get to 5 days, but the approach here wasn't optimal, right? If we had reaffirmed her efforts first, right, she would have felt more encouraged to continue developing that particular practice that she's under. So again, right, it's not just what you say, it's how you say it that we want to make sure students understand. And that is really at the core of motivational interviewing. So I'm not going to spoil the surprise for anybody who's going to experiment with this simulation. But the conversation continues, right? And again, our goal was to get to a SMART goal. There's a number of steps that have to be accomplished in order to do that. And in that process, we're going to expose the students to all of those key MI techniques and really help them understand what works well and what doesn't. But for now, I'm going to jump back to the menu and just take a closer look at the performance dashboard so we all get a sense of what that looks like. So I completed the previous Lisa conversations, and I'm going to look at the performance dashboard that's associated with that just to give us a sense of the level of detail and feedback that we can provide each student based on their specific performance. So at the top, we have an overall assessment, right? It gives us a sense broadly of how well we accomplished the overall goal. So we were able to work with Lisa, right? We had some wins, but she left her appointment uncommitted or unclear about her medication plan, which was our primary objective in this conversation. So obviously room for improvement here. Around the specific conversation goals, right, where we are meant to follow through with the key sequence of steps, exploring and discovering her motivations, using reflective listening to affirm what work Lisa is doing, and engaging in shared decision-making to, again, build out those SMART goals, and really assisting Lisa in understanding how to address those key barriers. So we see here we have some key qualitative feedback about how we did there. The scores can be an X for just didn't accomplish, check minus for room for improvement, and a check for when we really did accomplish that particular conversation goal. And then we also get assessed on our specific skills that we incorporated. Did we use enough open-ended questions? Did we ask about the agenda? Did we engage in discussions around the patient's beliefs and motivations? Use complex reflections, validate, and affirm. So again, lots of levels of assessment here. All of this is available to the student, also tracked on the back end for administrators and faculty to get a sense of how well students are doing. And then specific recommendations based on our performance about what we can continue to do better in the course of the experience as well. So lots to unpack with the performance dashboard, which is a great segue into discussing some of the tools available to facilitators and learners to support that learning, including a real detailed breakdown of what the performance dashboard ultimately means. So with that, I'm going to pass it over to my colleague, Dawn, to talk a little bit more about some of those additional materials.
Great, thank you, Gernick. So as you can imagine, as a former educator, the facilitator guide and the learner takeaways are, some of the most exciting features for me. I love to see this all come together using the simulation as just one component of a bigger implementation strategy. And so one of the nice things about the learner takeaways is depending on how each learner learns best, they can decide to preview those through the resources section in advance of what would be your facilitated workshop style overview that you can do with the group. So if someone wants to learn a little bit more about motivational interviewing, get a little bit more understanding of what they're about to experience, the learner takeaways really give them a preview of that. And within the facilitator guide, you'll see an overview of the product. You'll see feedback options in terms of the live facilitation and even additional role plays right at the end. But what you see here on the screen is kind of a walkthrough of what the middle and the crux of the facilitator guide offers you. And we do encourage you to kind of think about two things. When you first get ready to prepare, you want to decide if you're going to assign the simulation in advance of the deep dive that you're going to do with everyone, or if you're going to do kind of an introduction, a brief overview, and then assign the simulation. And either way, what you're going to have the opportunity to do then is to lead a really thoughtful and healthy discussion. Not only is the performance dashboard going to give you insights into some of the things that you might want to zoom in on, the facilitator guide really walks you through step by step how you can take advantage of the different goals from the simulation, the different levels of the conversation, so the selection of basic versus advanced. How many people took the opportunity to have a difficult or more challenging conversation with Kevin or Gregory? How many people selected basic versus advanced? And did they build their confidence over time as they interacted with both Lisa and Janet? By the time they had the option to choose, what did they choose? Did they decide that they needed a little bit more help and they really didn't want to turn off the feedback? Or were they excited to challenge themselves and see how they would do if they turned off the feedback? What kind of time did they truly spend in the simulation undoing some of the answer choices to kind of find their way with their own voice and their own language using the skills that are possible within the simulation? And so I think you can have a really healthy discussion that can go in many different ways. We also offer you the opportunity to continue role playing. So now that we've had the opportunity for the individual simulation experiences, how did your students decide to proceed? And then could they put this into practice in real time? So we took the time to script additional role play scenarios for you to give you options for perhaps breakout sessions. A lot of us are teaching either in person or in Zoom rooms right now. There's a breakout feature that you could utilize, giving people the opportunity to pair up and practice some of these skills and kind of just work on the language and the strategies that they learned. Are they able to do better reflective listening after having completed the simulation? Are they able to use the motivational interviewing techniques? They might be able to recognize open-ended versus closed-ended questions, but are they really building greater rapport and helping that less engaged, less motivated patient to continue to make healthier choices? Are they able to really hone in on some of those wins that the patient is sharing with them and amplify that, right? Reaffirming it, giving them acknowledgement, and saying to Janet, for example, I'm so glad to hear that you've been walking 3 days a week. 3 days is fantastic. Have you thought about adding an additional day, right? Can you do that a little bit differently and get their buy-in and get them inspired to make even better decisions the next time you see them? And so this entire activity can be as long or as short as you need it to be, but we're often hearing from our clients right now that they need more hours, they need more time, they need additional experiences right now. And so we want to give you the opportunity to make this a little bit longer of an experience. So you'll see very big time ranges here, and the time ranges are just based on what time you have allotted. You can also break them up into smaller segments and decide that this discussion and this role play may be part of one class experience, and then you may carry on to do a deeper dive the next time. So you can really break this up and take what you need and really amplify the experience overall. But in partnership with the facilitator guide and the learner takeaways, plus the simulation, we're confident that this is going to offer you a great opportunity to really work with your students to help them be better prepared for these real life encounters. The last thing I wanted to walk you guys through in the final minutes that we have is that we would like to give you the opportunity to trial the experience. Gurnik shared with you the Janet conversation. We are going to offer the Lisa conversation to you as a free trial. You'll have 3 weeks to preview this demo, and this gives you an opportunity to really get into the simulation, manipulate the conversation, go a couple different directions, leverage the Accord meter, really understand what level of engagement and trust you're building within that conversation. And as you experience that, if you want to see more of the simulation, we're going to offer you the opportunity then to schedule some time with myself or my colleague Brooke Handy. The two of us will field those calls and really be able to talk to you a little bit more about how this can work for your program and how it can best support you. And so I would encourage you to take a look at the demo. It will be made available to everyone who's registered today or who catches the recording. If you have any questions, you can certainly reach out to myself. Gurnik's contact information will also be available on the final slide. And then we do have a custom email that you can utilize as well, clinical.training@cognito.com. All of these will get to a person who is able to help you to take a look at how we can embed the chronic disease conversations into your curriculum and taking a look at leveraging those facilitator guides and learner takeaways. But I think that's all we have for today. If we have any questions, Scott, we may have just a minute or two for those questions.
Great, thank you, Dawn, and thank you, Gurnik, and thank you everyone on the line for sticking with us to this presentation. We're hoping that this information is relevant to you and can help you in your curricular development and education of future health professionals. I don't see any questions here, and we are at time, so I'll be respectful of everyone's time on the line. I want to thank both of our presenters again and offer just a minute if they'd like to give any closing words. Their contact information is on the screen if you have any questions for one of them directly, or as Dawn mentioned, you can email clinical.training@cognito.com for information tailored to your school.
Thank you all. Appreciate the opportunity. Look forward to hearing from you.
Thank you all. Have a great day.